Hello everyone, I'm Dr. Shweta, consultant obstetrician and gynecologist, Unitas Multispeciality Hospital, Kelambakam. Did you did you have a C-section in the previous pregnancy? Yes. Then are you wondering if you can undergo a normal delivery this time? Yes, definitely you can. So basically, you should understand what is VBAC. VBAC is nothing but vaginal birth after C-section. So before that, we should also know what is TOLAC. TOLAC is trial of labor after C-section. A successful TOLAC is called a VBAC. So we should know who are the ideal candidates who can undergo C-section or a vaginal birth after C-section. Not all women who had a previous history of C-section can undergo vaginal delivery. There are various factors and criteria which will be evaluated by your gynecologist. So what are those factors? There are the history of, why previous cesarean was done. So whether it was done for a recurrent indication or a non-recurrent indication. What is a recurrent indication? Recurrent indication is something which you cannot change, like the contracted pelvis is the pelvic bone through which the baby is born is small genetically. And the other one is the height. If you're a short statured person, if you're less than 145 centimeters, even then you will end up undergoing cesarean section. And what are the other non-recurrent indications, like the fetal position, like breech or the transverse position of the baby, or if the baby had a fetal distress for which section was done, or even other placental, low-lying placenta, or any other medical conditions. These are the non-recurrent conditions. So if this was the indication for your previous cesarean, then you can definitely try for a vaginal delivery this time. That is, you can have a trial of labor, TOLAC. So what are the factors we have to keep in mind? One is you have to maintain the record. The previous delivery record is very important, which the doctors will evaluate completely and then come to a conclusion whether you can be opted for a vaginal delivery or not. So if you have a single baby and if the head is a presenting part and you're almost 37 weeks of gestation, and if you had a previous vaginal delivery, or if not also with a history of previous C-section, then you are an ideal candidate to go for vaginal delivery this time. So what is the success rate? So vaginal delivery, VBAC success rate is almost 62 to 75% as per the RG guidelines if you had a prior history of one C-section or two C-sections. So are you wondering if you can have a normal delivery after previous two C-sections? Yes, you can. If you fulfill all the required criteria, then you can definitely try for a vaginal delivery. But it comes with its own complications and risks, which we as a birthing team will take care. And what are the complications of VBAC? Complications are scar dehiscence, so the uterine rupture, the increased risk of blood loss, the maternal fetal morbidity, or the fetal respiratory symptoms. All these are high in case of VBAC. But if everything is monitored in a structured way, then even this can be overcome. Then what are the benefits of VBAC? So benefits is like you have a speedy recovery, lesser hospital stay, the decreased chance of blood loss, and decreased complications of future abdominal, if you require any future abdominal surgeries, the chance of additions are less. And more than that, as a mother, as a woman, the accomplishment and the empowerment which a mother feels after vaginal delivery is this: a mother who delivers vaginally has got a feeling of accomplishment and empowerment. And what are the risks and other considerations when we have to think in case of VBAC? The chance of uterine rupture is almost 0.5% in a VBAC case. And when you compare it to a unscarred uterus, that is a person who had normal delivery and going for another normal delivery this time, even then they have a risk of rupture, but it is around 0.02%, which is not a big difference. Okay, so what is in your hands? What is that you can do as a mother, to have a successful vaginal delivery. The spacing, plan your spacing, birth spacing, it should be at least more than 1.5 years. There's 18 months and above, minimum 2 years when you're planning for the next delivery. And then your age should be less than 40 years, and your weight should be ideal, should not be obese. So maintain a proper lifestyle and have a proper antenatal checkups, regular checkups, and follow your doctor's advice. And even if you start your antenatal exercises as at the earliest of 20 weeks, you can have a successful VBAC. All the best. Wish you all. If you're a mother aiming for VBAC, then definitely you can choose Unitas. We have a very equipped staff birthing team, the doctors, the physiotherapists, and the nursing staff for a successful VBAC. And happy parenting.